everyone, my name is Peyton Owens, and I will be discussing child maltreatment in the foster care system. Since this is a complex issue, I will not be able to cover every aspect of this problem during my short presentation. However, I will discuss the prevalence of child abuse and neglect in foster homes, the everlasting impact abuse can have on a child, and solutions in order to prevent the occurrence of abuse in these safe places. First, I want to start off by clarifying the definitions of abuse and neglect. Abuse is an act of commission, and there are four distinct types, although psychological and emotional abuse are closely related. Psychological abuse is typically defined as repeated patterns of behavior that negatively affect a child's development, while emotional abuse is defined as behaviors that impair a child's emotional development and/or diminish their sense of self-worth. Physical abuse can be defined as a non-accidental trauma or physical injury inflicted on a child by someone who is responsible for their care and welfare. This is the type that we commonly think of when we hear the term abuse. Sexual abuse encompasses a large range of behaviors. Some of these actions include, but are not limited to, sexually touching a child, sexual intercourse and deviations with a child, non-touching offenses like exposure to pornography and sexual exploitation of the child. Neglect is defined as an act of omission. Researchers have identified four unique types of neglect: physical, medical, educational, and emotional. Physical neglect is a failure to meet a child's basic needs, which may include inadequate supervision or abandonment by a caregiver. A caregiver could also medically neglect their child by refusing to provide or seek health care when they have the means to do so. The third type, educational neglect, is the failure to provide adequate education and educational resources to a school-aged child. These guardians may permit truancy, fail to send their child to school, or may not enroll them at all. Lastly, emotional neglect is the inattention to a child's emotional needs. Caregivers who name-call, reject, and engage in unstable behaviors in front of the children may fit into this category. While there are other alternatives to foster care, like residential and adoptive placements, foster care is usually the first choice for children who cannot go back home, according to Cross and Tower 2014. But it should be noted that foster care is still considered a last resort for those in protective work, since the children or child is being removed from their home and their biological parents' custody. As the chart that you can see on my slide shows, that was created by the American Society for the Positive Care of Children. Children may be removed from their home for a variety of reasons, including neglect, parental drug abuse, and child behavior problems. However, children ultimately are removed to protect them, and this is the chief priority for professionals involved in these cases. A child may be at risk in the home, or the parents may not be able to adequately care for the child at that time. It is important to remember that there is therapeutic potential in foster care, and foster parents and the environment that they provide are essential to this process. Even though foster parents are supposed to protect and care for the child or children who enter their home, there are some who do not. Some abuse and neglect their children who are in desperate need of a protector and a caregiver. According to the American SPCC, there are over 437,000 children and adolescents in foster care, and this number has been steadily increasing over the last 10 years, as you can see in the chart. In 2016, there were 672,000 confirmed cases of child maltreatment in the United States. That is 9.1 victims per 1,000 children. However, it is estimated that up to 3% of children were maltreated while in foster care during that same year. The most common types of abuse and neglect foster children endured was neglect, physical abuse, and sexual abuse. While maltreatment is shown to occur less in foster homes, it is still occurring and must be addressed. This is a sad reality, and studies have been completed to demonstrate the correlation between pre-foster care maltreatment and maltreatment while in foster care. In their study, Katz et al. Found a correlation between pre-foster care maltreatment and maltreatment while in foster care. When compared to children with histories of low maltreatment, foster children with histories of multiple maltreatment were much more likely to report abuse and neglect while in care. Simply, Katz et al.'s research showed that prior victimization places these children at risk for re-victimization while in foster care, and poly-victimized youth are at the greatest risk. This correlational study demonstrates that the children who need to be protected the most are in fact at the greatest risk, even after they have been removed from their primary caregivers. In 2014, Morton found that child maltreatment in foster care can significantly impact youth. In this study, Morton interviewed 7 individuals who, at one time, were in the foster care system. All 7 of these participants had been abused, either physically, sexually, or both, in their foster home. The results of Morton's study indicate that the frequency of maltreatment in foster care is high, and that children are being re-victimized in their out-of-home placements. Further, Morton asserted that youth in foster placements are more vulnerable for re-abuse, which is an assertion that aligns with the findings of Cat et al. Study, which I just discussed previously. Disempowerment and anger are 2 main themes that emerged during this study, and Morton reveals how feelings of desperation and frustration resulted in high mobility, difficulty transitioning, and poor academic achievement among participants during their youth. However, maltreatment in foster care can negatively affect youth in a variety of other ways as well, and the impact of their victimization can last forever. The issue of child maltreatment in the foster care system is real. So what can we do to protect children and prevent child abuse and neglect in this system? I've identified a number of potential solutions to combat the rate of child maltreatment in foster care, but the solution I think would be most effective is the implementation of new training interventions for foster parents. The results of Greeno et al. Study, which I'll discuss on the following slide, support the effectiveness of a training intervention program for foster and kinship parents called KEEP. Interventions such as KEEP are an opportunity to improve the level of education and training available to foster parents and thus increase the level of care provided to foster children. Some other solutions I came up with include continuous training for foster parents in the utilization of more effective methods like group-based training, which I've shown in the research to be an effective method for reducing problem behaviors among foster youth. Some more are access to support groups for these families. This might help them cope with stresses and address behavioral issues that may arise with their foster children, and it could be a valuable outlet for these caregivers. There should also be higher standards for potential foster caregivers. More resources and aid should be available, and increased penalties for confirmed cases of child abuse and neglect may help deter some individuals from maltreating their children in their home. Since children in foster care have been abused, neglected, exploited, and traumatized in their prior household, they may still have distinct behavioral problems and needs that could cause additional stress on caregivers. If not properly trained on how to handle these problem behaviors, caregivers might react in a negative way, which could result in additional abuse and/or neglect for the child. Like I mentioned previously, the results of Greeno et al.'s study support the effectiveness of KEEP, a training intervention program for foster and kinship parents. The findings indicate that KEEP was successful in reducing behavioral problems among foster children. Training interventions like KEEP can benefit all involved. They can benefit foster children and foster and kinship parents if utilized. It's imperative that caregivers complete these trainings so children are not further victimized in foster care. We must protect children, especially those who have already been harmed and victimized during their young lives. They deserve a safe, loving home and a support system who cares about them and their well-being. The foster care system needs improvement, and while 3% may not seem like a significant number of children, it is, because the number should be 0. Without the implementation of new training programs like KEEP and the current lack of resources for foster families, this number will remain and children will continue to be re-victimized. However, change is possible and necessary in order to create a better life for so many children. Here are my references. Thank you for listening.